Do they really work? I'll put this question to you, Professor Richardson, to begin with. Do those campaigns for diet recommendations in countries, do they work?
I have to say that the dietary recommendations for increasing fruit and vegetables have been communicated to the public for the last 20, 30, or even 40 years. And there still is an enormous gap between the consumption. There's a gap in dietary fibre, and as we've seen, there's suboptimal intakes in vitamin C and many other nutrients as well. Clearly, the message is not getting through in one way or another. There's all kinds of efforts which have been made, as was indicated yesterday. But in fact, one of the things I think is one of the problems, or the several problems, but one of them, I think, is that there are so many messages about what nutrition guidelines should be. And fruits and vegetables tend to be a rather positive message, and the media takes up mostly on negative messages. And so we have a situation where messages about too much sugar, too much salt, too much fat, they seem to prevail. They get most media attention. And in fact, I think it's a bit of a distraction, really, from what we should be communicating. The other is the confusion in actual guidelines themselves. One of the slides I think Maggie put up was about the recommendations in the United States that half the plate should be fruits and vegetables. In the United Kingdom, for example, just on April the 7th this year, they issued another Eat Well guideline, which said a third of the plate, should be fruits and vegetables. There's also been confusion about whether fruit juices should be included or not. And it's really trying to translate all this confusing information into something that you can actually do. Guidelines vary across different countries as well. In the UK and several countries of Europe, we say at least at least 5 servings a day. The quantification of that is that one serving is 80 grams. So you're looking towards consuming 400 grams of fruits and vegetables a day. Most people haven't the foggiest idea what those amounts look like. And so there's really been a mishmash, a real confusion for the public. How we overcome that, I don't know. But a recent recommendation also came out on April the 7th this year, and this was from the Royal Society of Public Health. And they're saying, well, how can we communicate healthy eating? And instead of focusing on traffic lights and labeling and all these sort of things, they were saying, actually, we should try and relate the amount of energy consumed to the amount of energy expended. And they want to have a sort of activity alert. And one of the examples they gave was that it would be 26 minutes, I think it was, of physical activity to work off a sugary drink, basically. They put it in media terms. But it was quite an interesting approach, that you should link energy consumed, the calories you consume, with the calories you expend. And then people would recognize just how much it might bring the message home at how much a confectionery bar or a standard meal needs to be worked off, and for maintenance of healthy weight. And this is relevant not just to fruits and vegetables, but the discussion that's going to come on glycemic responses, the whole thing. So, to tell you the truth, I don't know exactly how things are going to work. All kinds of efforts have been made in different countries. We had our celebrity chef, Jamie Oliver, recommending fruits to be dished out, or to be provided in schools, I should say. And I think that worked to a certain extent, but there was a lot of concern about the quality of the apples that were being provided. I think in some cases the pupils used them as missiles at the teachers, and so there was a sort of general rethink on the strategy of how to do it. But I hope that's added a few comments, but I'm not sure I know the answer, really.
No, and I think you've highlighted the point of standardisation. And we talked a little bit about it. In fact, you did yesterday, Lynley. Is there opportunity? Are we expecting too much that we could have a more global standard if the research supports the fact and supports that information and the data is there? Could we ever have a more standard global dietary requirement across the board?
Well, certainly the World Health Organization in their series of dietary recommendations and goals. They've highlighted again the need for increased consumption of fruits and vegetables. But again, the elements that got the main press coverage was about the proportions of energy from sugar. And I think that really distracted many of the messages, the positive messages about fruits and vegetables. I mean, you might have other comments on that.
Well, if I sort of perhaps just draw it back to the vitamin C and standardisation, the answer is probably not, because we have some mega institutional powers, I'll call them that, such as one within the European Union, one within the United States, and they really are the two major players there. And they both are having slightly different approaches, not only to how they set it, but the ultimate outcomes. The best opportunity we have for standardisation is actually Codex, and Codex won't harmonise the entire globe, but I do believe Codex maintains its role to present a standard that is suitable for all countries. Predominantly countries that don't have their own standards default to Codex, but the Codex standard is almost the default there. But we always stand. I mean, you just heard Anitra say Australia and New Zealand. They don't really want to shift on the 45 milligrams in face of all the evidence, and I'm not sure I agree with the let's try and get them to incrementally increase, because an incremental increase is like probably 5 milligrams every 10 years. I think they just have to man up if is the thing, and actually tackle the issue directly. Yeah.
I've just thought of something else. When it comes to the consumption of at least 5 servings of fruits and vegetables, one thing that we tend to forget is that even if you do consume those, you're only likely to get about 150 or 200 calories. And so your requirement is for 2,000, 2,500 calories, and it's finding where those other calories are coming from in terms of whole grain cereals and all the rest of it. So we can make recommendations for fruits and vegetables, but their energy contribution, which is our prime driving requirement, is very substantially more. So the attention needs to be paid to where the other calories are coming from.
I think 2.5 is a little excessive. I think even 2,000 is probably a little excessive. There's some good arguments for calorific restriction.
That's a whole other symposium. That's wonderful. Can I just divert slightly, and perhaps to you, Margreet and Anitra, talking about skin health in particular, and what can we really eat to affect our skin health?
Do you want to do that? Oh, right. Oh. Do I need to use that? No. Okay. All right. Need to do something for brain health, I think.
It's that time of day. It's almost coffee break.
Well, we talked a bit about the collagen support, and we know that you can measure that. We know it with wound healing, so that's an extreme scenario. We know that, I mean, the skin is quite a complex organ, and most of what we're concerned about usually is the outside appearance thereof, which reflects what's happening underneath to some extent, but also, when we're rubbing things on, we're largely rubbing that into layers of dead skin and acellular material. And so you'll go out, and buy, and there are creams that kind of capitalising on the fact that you need vitamin C for collagen synthesis, so therefore put it in a skin cream and you can rub it on. So there's not a lot of work that's been done that actually ties vitamin C levels to skin appearance. Probably the best evidence we have for a good relationship are smokers. Now everybody knows that smokers develop, pretty poor looking skin over time, and that vitamin C levels are also depleted in smokers, and the kinds of changes that are happening in your skin over time reflect that depletion. So you're getting kind of oxidative changes in your skin over time that enhance dryness, enhance wrinkling, and we know that vitamin C will protect against that, and we know that smokers are low in vitamin C. So there's a correlation there. but not many intervention studies have been done to show that. The other thing that affects our skin is exposure to sunlight, and so that's UV radiation, which causes the production of oxidants in your skin, and that over time creates, sunspots and the kind of degradation that we see with ageing. Wrinkling is something else. I think that's a different process. But there are indications that having optimal vitamin C will support your skin better throughout your whole life. Some of those things you need to be taking, like when you're young, to prevent, once you're developing all the wrinkles and the sunspots a bit late, to then go, taking your vitamin C, hoping to reverse those things is a lot more difficult. So preventing the onset, there definitely does seem to be a role there. But once again, it's that incremental, don't look for a miracle cure here. It's that incremental increase where if you're optimal, you're going to get less of that, but you're still going to be exposed to sunlight and you're still going to age. And so, this is not a miracle, a miracle cure.
Just very quickly, out of interest, how do the nutrients get from the gut to the surface of the skin?
They are transported. So there are carrier molecules so when you take vitamin C in through your gut, there are transporters. Because it's a charged molecule, it won't diffuse through cells, it needs to be carried in. So there are molecules, proteins that carry it in, that transport it into the bloodstream, and from there every cell has these transporters for taking it up. So it will go from your bloodstream into your cells, and then, so for example, in your skin, the blood supply is only in the basal layer under your skin, and so only those cells tend to be exposed to vitamin C, and so the more epidermal layers are, they have less access, but they tend to have already stored it, and so it's a delivery system.
Excellent. Now, without oversimplifying things, and as we go in to the dreaded New Zealand winter, can eating kiwifruit stop me or my son from getting sick if I integrate it into our diet? Perhaps, Anitra, you might like to address this one. Can kiwifruit stave off illness?
Well, I'm not sure that there's, it's very strong evidence. There's been very few studies carried out looking at the effects of kiwifruit on prevention of respiratory infections, for example. But I think there is evidence out there for both kiwifruit and vitamin C for decreasing the severity of the infection, so the duration and the severity. So you'll still get the cold if your immune system is slightly compromised, but you will clear it more readily, and like Margreet said, you won't then go on and develop more serious conditions such as pneumonia. So there's definitely a role for it there.
So it's got a good place. It's part of the arsenal, and it's
just for maintaining daily intake to maintain a good status. Yes.
There was a small study done in New Zealand, a small pilot study that followed on from a larger adult study, and just talking about your child, and that was in a preschool. And it's not about prevention. I mean, first and foremost, it's about good health to start with. So being in good health, hopefully you're less likely to get an infection. But there was certainly a reduction in the severity and the duration of any infections that the children in the preschool got when they were consuming kiwifruit. And it was just half a kiwifruit a day for the littlies.
That's fascinating. I think, and we alluded to this yesterday as well, because we've talked a lot about bringing diet and nutritional habits and putting them into a small human really early in order to continue those habits growing up as an adult. And of course, Margreet, you alluded to that as well. Having vitamin C when you're younger is going to be much more useful, and especially as a habit habitually going forward as well in our health.
Well, there definitely is, too, a correlation between vitamin C status and susceptibility to illness. So having kiwifruit as part of your diet is going to keep you at that unstressed level, and so you will be less susceptible, but it won't prevent you know, you're still going to walk into the viruses, but we all know, you know, people contract viruses and shake them off much more readily, or other people get, you know, really ill. And so there is room for a varied response there.
Thank you. This brings our session to a close.